I want to thank the Galen Institute, the American Action Forum, and the Institute for Policy Innovation for sponsoring this. I am fond of saying that the passage of Obamacare was not the end of the healthcare debate in America, but rather the beginning. For a long time before Obamacare passed, a lot of us were talking about healthcare reform. I remember that I think in my first term in the United States Congress, I went to see the then chairman of the Ways and Means Committee to propose to him that what we really needed was a refundable tax credit to deal with the inequity in the tax code, the fact that if you're lucky enough to work for an employer who offers you health care, it is massively subsidized to the tune of at least 1/3. But if you're one of those in society who doesn't have a job where you're offered health care, the nation says to you, it's your social responsibility to go buy insurance, and we're so serious about that, we're going to give you the back of our hand and tell you it's going to cost you at least 1/3 more. His name was Bill Archer, and some of you who know him might know how that conversation went. You see, Mr. Archer had an adamant passion against tax credits of any kind. And he said, Shadegg, you're nuts. I don't like using tax credits for social policy, and that's a bad idea. And I said, with all due respect, Mr. Chairman, I understand your dislike of tax credits for social policy, but I'm telling you it's the right way to solve the health care problem. So from that day forward, I have continued to be, as Grace described, a policy wonk, but a policy wonk with a passion for health care reform. I think that passion comes from the fact that it is so obvious that we have a problem with healthcare in America, and to me, so patently obvious what the cause of that problem is, and yet we cast about, we convince ourselves it's way too complicated, we convince ourselves we can't possibly fix it without going to something akin to a single-payer system, or at least the massive insertion of government bureaucracy into healthcare. I would suggest to you that's not the right answer. And therefore, I would suggest to you that Obamacare is not the end of the healthcare debate in America, but rather its beginning. I understand that a number of speakers who came before me this morning made that case. In particular, my colleagues, Dr. Burgess and Douglas Holtz-Egan, with whom I worked during the McCain campaign on the healthcare issue. So I'm not going to spend a lot of time telling you how bad it is and how desperately important it is that it be dealt with. I'll talk a little bit about the specifics of that in a moment. But I want to begin with a story. I will tell you that not only was I working on refundable tax credits, but I was also working on high-risk pools and on purchase across state lines long before any of those were popular. Many of you know that the Congress passed, I think, the first high-risk pool, I believe, in 2002, and then in 2007, I had introduced a state-based high-risk pool bill. My chairman, Mr. Barton, came to me at the time and said, the Democrats like it. I had coupled it with a more conservative piece that I liked, and he explained, well, they didn't like that part of the bill, but they'd be happy to steal the part of it that dealt with high-risk pools and enact it into law. Well, when your chairman comes to you and tells you something like that, and you're in the minority, you say, okay by me, and I did. But here's the story I want to tell you. That occurred in 2005. That bill was passed and signed in 2006. Now, flash forward. Some of you may recall that a big part of the healthcare debates focused around whether or not Democrats were listening to Republicans. And you all know that the debate went on for the better part of an entire year or more. Some of you recall that because Republicans complained incessantly that they were not being listened to, late in the process, I believe in November of 2009, Mr. Cantor and Mr. Hoyer agreed that, by gosh, there ought to be some bipartisan conversations inside the Congress about healthcare reform. And so, as you recall, they set up a working group. I think Dr. Bustani from the House chaired the Republican side. I don't recall who chaired the Democrat side, but they all got together. Interesting story came out of that. One of my Republican colleagues came to me after about the third meeting and said, John, you won't believe what happened today. And I said, really? I'm very interested. And he said, I was sitting in the speaker's conference room waiting for this meeting to start. I had arrived a couple minutes early, and a Democrat colleague who was already in the room was sitting there next to me. We're waiting, nothing's happening. And the Democrat colleague leans over to me and says, so explain to me, what is a high-risk pool? Now, this is in November of 2009. We've been debating healthcare reform for darn near a year at that point, and this person was selected by Steny Hoyer because presumably of his or her knowledge of healthcare reform. And they leaned to the Republican and said, so what is a high-risk pool? I will tell you, that was stunning, but not quite as stunning as what you may all recall happened later on the same topic. Everybody remembers that ultimately the president, with high drama, convened a meeting at Blair House. And at Blair House, we had hours of coverage, minute by minute, every member making their point, and the president fielding those and demonstrating his thorough knowledge of healthcare reform. At one point, the topic of high-risk pools came up. I hear some of you snickering. Maybe you know what happened. On the topic of high-risk pools, the president calmly explained to a listening nation that the problem with high-risk pools is that you take all the sick people, you put them into the high-risk pool, and you make them pay for their care. Of course it's going to run out of money. Really, Mr. President? Is that how a high-risk pool works? I would suggest to you that those are the reasons, just some of the reasons why the passage of Obamacare is the beginning of the debate on health care reform. If the president himself does not know the fundamental nature of a high-risk pool, which Republicans had been advocating as the solution for people with pre-existing conditions, and it was people with pre-existing conditions that was a part of the outrage which led to the passage of the bill, then there's something deeply wrong. As every single one of you, I hope, knows, the entire notion of a high-risk pool is that those with high risks, those with expensive health care who cannot either get coverage at any price or who can't get coverage at less than, we'll say, 150% or 180% of what they would charge someone who didn't have that high-risk condition, they are automatically entitled to join the high-risk pool. They pay a premium which can be 10% or 15% above the premium for a normal, healthy person that didn't have the high risk. And then, because you've concentrated all the high-risk people, that pool will have higher costs, which are subsidized in any one of a number of different ways. The most common way, or the one I like the best, is a surcharge on all insurers in that particular jurisdiction. If it's a state-based high-risk pool, you surcharge all the insurance companies, and they kick into the cost of it. You can also do it, some states do it by a dedicated so-called sin tax on tobacco. You can do it with regular general funds. But that the president, when he was at Blair House, did not understand that this was a long-standing mechanism enacted already by the Congress, in place in a number of states, that if implemented properly would eliminate people from being denied care because they had a pre-existing coverage, tells you that we have a problem if that's the guy that guided the passage of the bill. Let me suggest that this is too important an issue to allow it to have been passed in the kind of partisan, heated, by God, it must pass now or never circumstance in which